Okay, let's get going. And I am really delighted to welcome all of you to our third Research Creative Achievement Town Hall. We have a pretty full program today, and we are delighted that we have over 250 registrants looking forward to sharing with you where we are in our planning for relaunching the research activities on our campus. This, as you know, is our third town hall. First one was back in April. Second one was about 3 weeks ago on May 8th. And the slides and the actual videotaping of those two town halls are available on our websites. Today's panelists are listed here, and all of them will speak at some time during this town hall. So I will introduce them at that time. But I want to hand over to start our town hall to our provost, to Philip Rouse, to say a few words. Philip.
Thank you very much, Carl, and welcome to everybody to the town hall. I'd like to really thank you for taking the time to join the town hall today and for everything that you're doing to support our mission as a public research university. As you know, we have a mission. We must execute on that mission. Research is a critical part of that mission and affects virtually everything that we do on this campus. And I'm very grateful to the research planning team, to Carl and all the other people that have been working on this for really working tirelessly on this very complex matter of how we can relaunch research at UMBC. I also recognize, and I said it before, but I'm going to say it again, we recognize that our research and creative achievement activities have been disproportionately impacted by our response to COVID-19. We appreciate your patience and your understanding as we work through all of these issues. The research team is a part of an overall planning group, a large group consisting of over 100 people that's overseen by what we call the Fall Planning Coordinating Committee, which actually consists of 5 subgroups. One obviously in research and creative achievement, one in academics, one in facilities and operations, one in students and student life, and one in community engagement and events. Of course, it's really important to note, and this is one of the complexities of this planning effort, is that those groups can't operate in silos. They have to be highly coordinated for obvious reasons. The way in which facilities interacts with research, the way that academics interact with research, etc. So it's called the Fall Planning Coordinating Committee, I suppose, because much of its effort is focused on the fall semester and what's going to happen there. But I want to mention that we, of course, recognize that it may be possible, as well as desirable, to begin to relaunch some on-campus research and creative activities earlier than the fall. The research team, and you're going to hear about that today, has developed a phased approach, and we will move up through those phases as conditions permit. And it's also possible that the conditions will mean that we have to retreat slightly in our phases too, and that's part of the planning. Currently, we're in phase 0, and phase 1 would mark a very careful and considered return to very low density research and creative activities on our campus. That's all part of the plan that I think you're going to hear about later. Now, of course, we can't give you the exact dates when we will be able to move between these phases. And that's, of course, as you understand, because of the highly dynamic circumstances and also the number of things that are unknown at this point, for example, relating to testing, monitoring, etc., availability of PPE, as well as the evolution of the coronavirus itself. And I believe it's actually fair to say that we do not anticipate being able to move on from our current state to something like phase one before the middle of June. I want to let you know that you're going to hear a lot more in the presentations and the discussion today. Once again, thank you so much for everything that you're doing. And with that, I'm going to hand it back to Carl to lead the rest of the meeting. Thank you.
Thank you very much, Philip, for these introductory works and for giving us a broader perspective how the Research Creative Achievement Team fits into the broader planning of the campus and giving us a little bit of a look ahead. So the agenda that we're going to work through today is to provide you an update on the framework for relaunching RCA on campus, and also an update on the survey questionnaire that so many of you have responded to. And then we will go into the next steps for reopening on-campus laboratories and studios, more details on what Philip just shared with us. Dean Rutledge is going to share with us some feedback from yesterday's graduate student town hall, which had also very significant participation. And I do hope that some of our graduate students are joining us here today as well. Don Engel of the research office will talk some about the questions and guidance that we can give you about how can we support you when you do your research creative achievement under remote conditions from home. And then Dean Drake, also from the research office, is going to moderate and go through those question and answers that many of you posted already in advance as you registered. As you go on the research.umbc.edu site, there's an immediate link to this page, which provides you with up-to-date information that is coordinated, but coordinated with the broader UMBC COVID-19 page, but specifically highlights areas relevant to the research community, including the link for today's town hall. As outlined in the prior town halls, we established a research access exception task force, the RAET team. It has grown from the initial 5 or 6 to about 10 people today. This group has now met close to 40 times in the 2.5 months that we've been in existence. And it really has allowed us to have very detailed and very open conversations amongst each other, as well as with groups that we bring in from the shared services centers, from the building managers, and other experts on campus that help us go through specific questions. Since the task force was established, we now have over 220 total requests that came in for access to campus. And as you see on the numbers on the right here, about 1/3 of those questions requests were not detailed enough or requested access for activities that we could not feel comfortable to bring you back for, so they were denied. About 1/3 were one-time requests, and about 1/3 were multi-time requests, once a week or every couple of weeks to come in. So if you really go through that, there's on the order of maybe 20 to 25 researchers coming to the campus every day. That is a trickle of the total research community, obviously, that we have on campus. About a month later, back in April, we expanded the group of experts that we were working with across the campus. The so-called Task Force to Reopen Labs and Studios was founded, and that is now in existence for 6 weeks. And very quickly, we divided that group of 35 individuals into 3 working groups that you see here: the Wet Lab and Dense Research Group, the Core Centers and Sensitive Equipment Group, and the Community Engaged Research, Fieldwork, and Performing Arts Group. The members of these communities come from all across the campus, from the library to graduate students to faculty members to individuals that look into environmental health and safety, etc. As we go through our planning, obviously we look carefully what is happening across the state, across the nation. All of you have watched the Johns Hopkins site. This is the Washington Post site from yesterday, where we just passed 100,000 deaths within the United States, and we are reaching towards 2,500 deaths in Maryland at this time. So this is a very active virus, although it's been getting down a little bit, but it's still a very serious condition. And you can also go on the coronavirus.maryland.gov site that gives you more information as to what is happening within our state. So we are watching this not just in the RAT team, but across the entire campus. And we're working very closely with colleagues in USM, as in the research community in UMB and College Park, but also are active members in the APLU Council on Research that on a weekly basis provides webcasts and gatherings of up to 120, 130 vice presidents for research from across the country. So that is a little bit of the background on where we are on the framework. And I want to spend 5-10 minutes on giving you some feedback on the survey questionnaire. So many of you have responded to this questionnaire that we launched on May 15, which was 2 weeks ago today. And here are some of the very high level responses or statistics. We received 474 responses out of about 680 total faculty on campus. That's a response rate of 70%. And it really deserves a big thank you to all of you who took the time to share with us both your needs and your desires to come to campus and what concerns you have. And we will respond to that today. The other number that's highlighted below it is out of the 474 responses, about 28%, 135 faculty responded, yes, I really need to come back to campus as soon as possible, while over 70% of you said, I can wait until the fall, or in some cases, like our NASA centers, many people said, my research labs are off campus, so our on-campus guidelines don't really apply here that much. Now, for each of the 135 faculty members responding, we also ask how many people are in your teams, and those were 520. So each faculty member has on average a number of a team size of about 4 people. And so currently we have 520 individuals who through their faculty have raised their hands to say, I am interested in coming to campus. The rest of the data I will talk more within graphics, but these will all be posted online after the presentation today. So out of the 474 responses, we had about, not surprisingly, a large percentage of colleagues from CAS because they have the largest number of faculty. You see your COED, CNMS centers, and responses from the library, from social work, and from Erickson. And the response rates have just been tremendous, between 83% in Erickson and to 65% in COED, or you know, you see the numbers right here. So all across the university, all of us stepped up and took the time to share with us what your needs were. So out of the total number of responses per college, in blue, you see here how many of you said, I need access as soon as possible. And that is very important for us to know that many of you understand that remote conditions will apply for quite some time for us. And those of you who say, I can work remotely, I may have to come in every couple, 3 weeks to pick something up. That helps all of us work through with those individuals who really need to come back to campus to conduct their work, which they cannot do remotely. Over 200 responses were received out of the total from arts, humanities, social sciences, about 95 from CNMS and 72 from COED. The other numbers of the other schools are much smaller, but the biggest point is it really, we received responses from just about every single department on campus. And again, that speaks highly how the campus responded to the survey. So now we're looking into those individuals that have requested access. And I just said we had 135 faculty for a total of 520 individuals. And what's interesting now is the distribution of individuals who say we need to come back to campus is almost even between the 3 colleges, as you see here in the pie chart on the left. And a small number of individuals into the centers also require access. Really, none of the Erickson social work or library faculty indicated that they need to come in. They may need to come in once or twice for something between now and September, but I'm going to leave those out in the next slides. What shouldn't surprise you that the largest number of individuals for COED and CNMS are graduate students, with a small number of undergraduates on the top here. In CAS, however, the numbers are reversed. There's a much larger number of undergraduates that are actually working in the research community there, but still a sizable number of graduates that would need to have access. This particular slide just goes from the initial 1,300 individuals that are included in all of you who responded to the survey down to 950 individuals who were amongst those that said, I need to have access. But those of you who filled the survey out were also asked, under COVID conditions, tell us what's your minimum number of individuals that need to come back. So you may have 8 people in your lab, but maybe, hopefully, only 4 or 5 of them will need to come back. So it brought it down from 950 to slightly over 500, and that was really the intent. And as you see here, the largest number on the current list are the graduate students for engineering and the sciences and arts and humanities. There is a significant number of undergraduates that the faculty are requesting access. So that just gives you a high-level overview of the responses, and it tracks very well from number of submissions to number of individuals say I need to come in, to the green number of minimum access as soon as possible, and that holds true across the whole university. It is important for us to know which buildings you have a desire and a need to get into, and it was very informative and helpful for us to get your feedback. You see on the left, it's a large number of buildings. It's not just 3 facilities. And there also isn't one facility that sticks out and 80% you have access to, let's say, the library. So it's it looks like a big pizza here with a lot of similarly sized slices, and on the right side, the numbers. Biology, for instance, has 25 individuals that need to come in versus public policy may only have 5, and that helps you with guidelines of how to plan to come back in the future. Other facilities do you need to have access? Many of you work in your labs or in your offices. But many of you require access to other shared facilities. That could be the Aquaculture Research Center in the Columbus Center. That could be our high-performance computing facility. That could be the Keith Porter Imaging Facility or the Molecular Characterization Analysis Complex. But it could also be the library, and that actually is the one that sticks out here with the highest number of requests. And we're obviously working closely with Patrick Dawson and the staff and the faculty in the library to work through what conditions will we have to have in place before we can meet that need. And at the very end, there were a couple of questions of how many of you, when you come to campus, would also need to go off campus. And off campus could be a broad set of questions. It could mean that you need to work on the Chesapeake Bay to collect data. It could mean that you need to visit a local hospital or an aging, a retirement home or things like that. And in turn also, would you need to have visitors to come to campus and work with you in order to move your facility, move your research activities forward? And so on the left, only a small number of you, those that said, yes, I need to come in soon, only a small number said, I need to visit some other sites. So it's only about 28 of you. And only about 12 of you said, I need to have the ability to welcome visitors from the outside to come on campus. It is very helpful for us that these numbers from almost 480 responses, that we have a couple of handful of individuals, so it makes it possible for us to go through one by one and really understand what your requests are. So again, big thank you to all of you for taking the time to fill this out. It does allow us to drill down much quicker into our planning on how we can help you come back under the best possible conditions. On that note, I want to hand it over to some of my colleagues who are going through some of the next steps as we are taking the survey and many of the conversations the last 2 months and now preparing for reopening. And with that, I want to hand it over first to Karuna Pandey Joshi. And Karuna is the chair of our Research and Creative Achievement Council, and really been a tremendous asset during our conversations here. Karuna.
Thank you, Carl. Good morning, everyone. Good to see you all again. I hope you're all safe in your house. And as we begin thinking about the relaunching process, we are following the 4P guidelines that we shared in the previous Research Council town hall. And we are also cognizant of the fact that UMBC follows a shared governance policy, and we want to have a transparent decision-making process. So the 4 key guidelines, the 4 Ps that we are following are, firstly, to protect our faculty, our staff, our students, and everyone who's coming to UMBC. So we will follow the local, state, and national public health authorities' guidance, and we will implement social distancing as when the relaunch happens. We also hope to protect the emotional and physical health of our researchers, of our scholars, and all the human research subjects. To ensure this protection, we have to prioritize. Obviously, the phased-in approach that we have been talking about will have to be implemented. And so we will prioritize the participation in finding cures and prevention for COVID-19. I believe we already have research teams working in UMBC towards that endeavor, and they are right now doing lots of projects to implement that. We will also prioritize RCA activities with low risk to individuals under COVID-19 conditions. So that will be one of the guidelines for prioritization. And of course, we want to prioritize early stage careers, including those of faculty, postdocs, and students. So the university as a whole is very aware of emphasizing this and prioritizing it. To prioritize, we'll have to go through some processes, which we hope to be fair and transparent. To give everyone who wants to access. And obviously, some strong and hard decisions will have to be made. Some people who want to come in may have to be refused. Some others will have to be, given strict guidelines. Some will have to provide PPE equipment, masks, sanitizers, etc. And the university is working towards policy for that, and also providing those equipments. And we understand that this is an evolving situation. We understand that we don't know what the virus future is going to hold. So we are ready to pivot. We will facilitate a rapid restart of the RCA if the public health conditions permit. If tomorrow the state says let everyone in, we might consider that. But we are also going to be prepared for shutting down in case some adverse conditions start happening and we cannot relaunch. So with these guidelines in place, I'm going to hand it over to my colleague Praminda, who's going to discuss the next steps.
So Praminda Jacob, thank you, Karuna. Praminda is the Associate Dean for Research and Community Engagement in CAS. Many or all of you know her already, and I appreciate Praminda working us through the phased approach.
Thank you, Carl. Good morning, everyone. Just wanted to say that the phased approach, Provost Rouse has already mentioned this, and what you're looking at is the slide that kind of details these different stages. We are now in stage 0, whereby this is our research maintenance mode, and we have like about 5 to 10% of normal RCA access. And mainly, like Karuna said, the type of research that's ongoing on campus is related to COVID-19. We are hoping, and that's what the whole questionnaire and the survey was about, was getting ready for stage 1, when we estimate about 10 to 20% of normal RCA activities. And so we, with all of your responses, we are hoping that we will have all the necessary information and also the facilities prepared along with PPE, etc., so that we can start low-risk RCA activities and with the proper social distancing in place. If all goes well and there are no more, serious outbreaks, we can move to stage 2. Nobody knows now when that would happen, but if that would relax even more the ability for people, for restrictions, and more people we can welcome onto campus, and that would estimate about 20 to 50% of normal activities. Then moving on from there to stage 3 represents even a greater relaxation of RCA density constraints, and we estimate about 50 to or 90% of normal density. And finally, stage 4, when we're back to normal full campus density and activity. In terms of when each of these things will happen, that is still very uncertain. About stage one, maybe Carl will be mentioning something about what we are expecting, but we really don't have any firm dates for any of these different stages.
Thank you for that overview, Praminda. And the provost mentioned at the beginning that at this time, we do not expect a transition to stage one until at least the middle of June. And we're obviously working very closely with the governor's office, USM leadership, UMBC leadership, but it is up to us collectively with all of you in the research community to be ready when the green flag comes and we can start bringing some of you back to campus. I want to hand it over to Chuck Biebrick, who is the Associate Dean for Research in CNMS, and Chuck is going to talk to us a little bit about physical distancing guidelines. Chuck.
Thank you, Carl. Hey, everybody. So as Praminda mentioned, we can only come back on campus with appropriate physical distancing. So what does that actually look like in our research and creative achievement spaces? Thank you to Mike Hayden for providing this image of how it might look in physics with either 12-foot indicated by the blue circles or 6-foot radius circles representing the space that each investigator might occupy. What that translates into is 435 versus 110 square feet. Right now, we are adopting what seems to be emerging as a national guideline of 350 square feet per investigator or creative achiever within that given space. So we encourage you to begin thinking about your space. That's why we asked you how much space you have on the survey. But we recognize that these sort of decisions need to be made at a very local level. For example, you know whether or not how much of that floor space is available, how much is taken up by casework and equipment or production equipment, whatever it may be. So as you continue to have conversations with your chairs and ultimately with the deans about how many people you can safely bring back, we have to use common sense. Your lab may be 1,000 or 1,100 square feet, but if 60% of that is taken up by equipment, maybe you can't put 2 people in there. So in many cases, that is going to devolve into 1 person per room, even for rooms that have greater than 350 square feet. So again, I encourage you to think hard about how you can safely do that within your assigned space.
Thank you very much, Chuck. And I want to hand it over to Aaron Lavik, who is the Associate Dean for Research and Faculty Development and COEIT, and to work us through some of the questions that you and the other Associate Deans have been putting together to help the faculty think through that planning.
Thank you. And thank you, Chuck, for going through the space density and Praminda. So focusing on the questions, these are really the things that we need to understand so we can figure out how to do the prioritization of bringing people back. So one of the first things we need to understand is how can your work be conducted remotely and what impact do you have if you're remote? For some investigators, it would be really great to be on campus, but they can do a substantial portion of their research remotely. And for some investigators, the reality is they essentially can't do any of their work remotely. So we need to be able to understand that. We then are going to ask you all to put a plan together, how you will do your work and the number of people you will use in your space. And I've reached out to some of you already, and I know Chuck and Praminda have reached out to you and your chairs have reached out to you, really thinking about how will you schedule people, how will you have shift work or other things to reduce the density as much as possible, because that's going to be a critical part of this. You're going to need to explain the safety procedures to deal with the virus. And obviously we've talked about PPE and social distancing as 2 of the critical parts of this, but how also will you do wipe downs and other procedures? And especially for those of you, and it says science, but this is important for, I think, all of us, regardless of our discipline. How are you going to be safe in that space? You know, very likely you're going to have a low density of people, and certainly in research labs, we always say have a buddy with you. That may not be practical here. So how are you going to deal with that? One example would be to have regular call-ins to let someone know that you're okay. And so we're going to ask you to do that. We're going to ask you what the most dangerous parts of your work are. Do you have volatile gases, high voltage? Are you on high scaffolding? And really help us think through what those issues are and how we can help you do that work safely. And then the final thing, and this is the dark question that we have to ask, is if there is an outbreak, how can you shut down that work? Because we can't be sure that there won't be, unfortunately.
Erin, can you share with us how you have distributed this already? And I'm going to ask Chuck and Praminda afterwards as well.
Right. So in the case of my college, I took those who said that they wanted to come back immediately, and I've contacted them and let them know how we're starting to think through this process. We have plans in our college of the spaces, so I was able to tell people the square footage of the labs that they're interested in returning to, and then start talking about some of the issues they'll want to think about as they're putting their plans together.
Wonderful. Chuck, can you give us an update where CNMS is?
Sure. So the information regarding the respondents who needed to come back before the fall was sent out to the chairs, and they are now initiating conversations with those investigators, as well as perhaps a few who failed to fill out the survey, but are still interested in coming back before the fall. So yeah, that's happening through the chairs.
Wonderful. Praminda, what's the update from CAS?
Yes, so just wanted to say thank you so much to all the CAS faculty. More than 200 of you did respond to the survey. And so yesterday, I sent out a message to all the chairs and directors in CAS that details the information that both Chuck and Erin have just shared with you in bullet points. So, and I've asked the chairs and directors to share that information with all the faculty in their respective departments. So I'm expecting that you will all receive that shortly if you haven't already. I also shared with the chairs and with the department chairs the requests from those faculty in their departments that said that they need immediate access, so that the chairs are knowledgeable about what their needs, specific needs are, and can start creating a plan. Many CAS faculty did indicate that they needed the library, as you saw in the graph that Carl showed. And what we are indicating is that Dr. Patrick Dawson, the director of the library, is working on a phased reopening plan that will be shared with the campus. And finally, like Erin said, we are really requesting that we keep the densities low. So we are hoping that faculty will only use their offices to pick up and drop off materials in this stage one, and that only those faculty who need their studios and labs to work where they can't otherwise work at home will use it. And these are primarily the 4 arts departments, ancient studies that has an archaeology lab, psychology, and GES also. So that's mainly the information I have at the moment, Carl.
Thank you to all 3 of you for both the leadership. And I want to just give a big thank you to the entire RET team. As I said, we've met for about 40 times already, and all of you are just donating so much expertise and so much time and passion into these conversations, and it really has helped us to understand many of the issues, because a campus is diverse, a campus is complex, so one answer doesn't fit all, and so we've adjusted and pivoted a good number of times as we were getting closer to opening. A couple of words I wanted to share. One is I think it was Erin who mentioned shift work. Shift work can take different ways, right? If you have, let's say, 4 individuals who you need to bring back, but only 2 of them can be in the lab at any given time, shift work could mean there's a morning and an evening shift, yeah? 8 hours here or 6 hours here, 6 hours there. So you minimize the number of people being together at the same time. It could also mean Monday, Wednesday, Friday for one group, and the other one Tuesday, Thursday, and Saturday. And yes, Saturday is a day we could come and do work. So in these conditions that we're under, these are options that we want to encourage all of you to think through. And one other point that I want to make, we're very closely working with environmental health and safety, with Mike Pound, who just shared with us yesterday that we do have a pretty decent stock of the basic PPE, the basic personal protection equipment, general masks, nitrile gloves, and cleaning supplies. So for those of you who are coming back to campus, we are currently thinking through and working out how do we make that available in your building, probably through the building managers. But we want to make sure that you understand that when you come in, we will have the basic needs. N95 masks are still a very high premium across the country, as you can imagine. And for most of the work that you do, the overwhelming amount of you will not need N95 masks under the guidelines that we currently have. So we should be in pretty decent shape to get you outfitted with equipment as you come in. With that, I would like to move over to ask Dean Rutledge from the graduate school to share give us a little bit of feedback on the conversations and some of the questions and concerns that came from the graduate town hall yesterday. Janet.
Thank you, Carl. As you can see here, this is the agenda from our town hall meeting that was held yesterday evening. We had about 130 participants. This was an event that was co-sponsored by the Graduate School and the Graduate Student Association. And GSA has very much been a part of this, as has the GA Advisory Committee, which is the GAAC, with representatives from both groups serving on the working group teams that Carl mentioned earlier. More than half of the session was devoted to the academic fall opening for courses and for other parts of the campus, as well as relaunching research. And you can imagine that there's a lot of concern over what is going to happen. And I think based on the questions and the discussions, people are mostly pleased that we are looking toward a mostly online environment for courses, and that so much careful planning has been going into the planning for research. Many of our GAs, as you know, are really eager to get back in the labs. Their progression toward their degrees is being held up by not having access in some cases. They understand why, but they would also like to get back to work as soon as it is safe to do so. We also covered some of the policies, and I do want to clarify here about the late withdrawals and P grades, because the deadline for doing any changes is June 10th. At the undergraduate level, a grade of D is considered passing, but it's not considered passing at the graduate level. However, for the university standards, a P is a D and above. We don't have something separate for graduate students. Since a D has always been unacceptable performance for graduate students, we encourage anyone who wants to remove that D or F from their record to use the withdrawal option. The P grade is really only appropriate for a C or above for graduate students. And all of those changes have to go through the graduate school, so we will be able to enforce it. So while that's not directly related to research, while I had a captive audience, I wanted to get in that very important plug. The graduate school and GSA will continue to have activities during the summer to promote research and writing. We will have Dissertation House to help students progress toward their degrees. Our dissertation coach is still working all summer, as is the GA writing advisor. So we will be doing all that we can to support our graduate students to continue to make progress toward their thesis and dissertation completion.
Thank you very much, Janet, for that feedback. It was a really good program that you put together, but I saw also from the question that the students were asking, this is burning under their fingernails for obvious reasons, right?
Yes, absolutely.
Classes are over, right? And all graduate students, this is what you do in the summer. You go in the labs, you go into your studios, you do that research and creative achievement work. We just want to ensure all of our graduate students that we are fully aware of the impact this is having on the progression of your careers right now. So,
and one more thing that I wanted to say is that Dissertation House will be held, I believe it's July 7th through 10th, and applications are open for that now. If people go onto the graduate school website, as I said, it'll be completely virtual. So please encourage your students to apply. It's students who have participated in the past really say that it helps them to make progress with the writing phase of their thesis and dissertation.
Thank you, Janet.
Including the dissertation proposal stage.
And you have more information on your website as well.
That's correct.
Okay. Let me hand it over to Don Engel from the research office to go through some of the questions that were raised by all of you who submitted the survey on how we can support you for your remote conditions. Don.
So the survey was primarily about what we can do to help prioritize which research needs to happen on campus, but this is really part and parcel of making sure that we are understanding what we need to do to support people to be able to be effective from their remote working locations. Now, more than 70% of the respondents were okay to keep working remotely and didn't put the as soon as possible response in anyway. And helping those people to remain in that category is very important, but also helping to make sure they're productive in that category and staying sane is important as well. We had 144 responses that weren't blank to this, so that most people who responded to the survey at all give us thoughts on how we can help them to be doing their research and creative activities remotely. We need to say as a preface to every slide I'm about to show you, safety is our top priority. Keeping people at home is first and foremost a safety concern, but also the ways in which we can help you need to be coupled with our concerns about how we can help you without lots of people going to campus in order to help you stay home. So we don't want to put lots of librarians at risk so that people can stay home. We want to keep everybody at home as much as possible without being foolish in the ways we can otherwise advance productivity at the same time while remaining safe. So this involves a lot of creative thinking. There's existing resources. Some people, and I'll get into this in a moment in more detail, some people ask for things that they might have presumed we would need to spend new money on. New money is very hard to come by. You all probably saw the email from President Grabowski about the gloomy financial future for the state because of all the COVID-related financial uncertainties and expenses. But there's a lot of existing resources. I think if we work creatively and are nimble, we might be able to help resolve some things where people have real needs with things that are sitting idle on campus. We'll talk about that in a minute. And there's a wide range, very wide range of both what the obstacles are and what the opportunities are. So a lot of this is going to be individual. Individual stuff is best handled often through departments and other units. We don't need to be the gatekeepers on that, but we want to make sure that we're understanding holistically what the situations are. So the number one thing that I saw in response to everything that you're about to see was that there's a lot of ambiguity about what the current options even are for people to do procurement and other things. So we'll talk about that in a minute. If we could go to the next slide, please, though. This is the distribution. So this question that we asked was an open text field. And I then took all the responses, the 144 responses, and clustered them around topic. By far, most of the responses were in three categories. And the number one category, I had originally phrased library, but I don't mean to be thinking in a box. And what people really need is access to books and special collections. And there's ways in which that is our library. There's ways in which that is not necessarily our library. We just need to solve the problem, not necessarily with a preconceived notion. So I had written library, but really books and special collections are the need. Access to own office is the second most need. Technology, a lot of these comments were actually just people thanking us, thanking DoIT, especially for all of the kinds of support that have been in place already and just asking that that continues. But there are additional requests that are all in there, and we're going to do our best to respond to everyone individually eventually. But the main reason I'm putting this question in was to make sure that our holistic approaches as the central unit were well informed, that we were also connecting the domain units, the DoITs and the libraries and the central resources, as well as the departments, to what the bigger picture is, what people are facing challenges. Financial policies and process, there were a lot of people saying it would be easier if they could do X. And in many cases, X is already possible because the policies have been shifting. Talk about that more in a minute. Home equipment, everything from furniture to scanners to things more fancy. Communication was mostly people asking that we be We continue to be really good at communicating, where some people felt that we could have been doing better from the beginning in communicating what the policies are that are coming down the pike. We only know so much ourselves. People asked for workshops. A lot of the workshop requests were actually about teaching, with the idea that more support for teaching means more bandwidth for research, because you're having to put more bandwidth into teaching than you would otherwise, and teaching is less optional or less postponable than research, although we hope that everyone understands this is all part of your core duties. And when I say research, of course, I mean research, scholarship, creative activities. PPE testing and health was another thing raised here, sort of ambiguously as to whether people were concerned about that as a thing that would let them return, but also I think having the right access to those things will let them venture out in ways that would support their research without coming back to campus. Campus access got raised, even though this was a question about lack of campus access. And personal services. So I heard unofficially that people didn't respond with personal service needs as much as they might otherwise, either because they didn't think it was in scope or because this wasn't an anonymous survey. And there we have things like childcare and other matters. I'll have more detail on all of these in a moment. So we could go to the next slide, if you could. So books and special collections, originally what I would have called the library. All of these answers are informed by a very thoughtful, deep response I got from Patrick Dawson. I'm really grateful for all the work the library is doing behind the scenes to prepare for all of the different eventualities, and also on one-to-one cases, handling a lot of very specific needs for people who have brought them to the relevant librarian. If something is available digitally, the library is there to help you get it. It's important to know that that includes if things aren't available digitally within the UMBC library. Some things are available digitally through interlibrary loan. So we are working to make sure, the library is working to make sure that you can get everything that is not a physical object in any way possible, even if it is something that is not normally available to you in digital form, that can be acquired digitally. Similarly, the library is very interested in acquiring additional online materials, both for research and for teaching. And that can be through interlibrary loan or other means, just acquisition through their normal budget. They'll be able to scan things. A lot of people said, can the library please scan stuff so that not a lot of people have to go in. Maybe it's just one librarian working for the whole library. This is at some point part of the phased reopening plan that the library is developing. They will have people scanning things so that you don't bring the possibility of infection into the library. Similarly, interlibrary loan is part of a phased reopening. Ultimately, there we are beholden to the courier service, and the courier service is currently not operating. The courier service is between USM and affiliated institutions. So Hopkins and a couple other places are part of the interlibrary loan system, and that courier service will, I'm sure, start at some point during the phased reopening, and that's where the physical interlibrary loan stuff sits. Yeah, so in initial phases, the library anticipates that they'll be making materials that you would request that are physical materials that can't be done digitally. Digital stuff is already available to you at some secure pickup location. We don't have that yet, but the library is planning on that being a very early stage of a phased reopening. Next page, please. So the next most popular topic was stuff related generally to financial policy and process. I'm grateful to the folks in procurement and finance who got back to me on a lot of these questions, but some of it, they were just able to tell me people need to know what the current policies are, and they need to do that through their department, and they need to work through the department. There's a lot of things people were asking for that are already possible, but it's a very fluid situation. So policies that were initially more restrictive have now opened up, or at least opened up processes that will allow you to do things. For example, travel reimbursements from travel before any of this happened. And reimbursements for direct expenses are flowing as normal. They're all being done in a timely way. They were originally held back in a variety of ways, and I think there might have been a backlog at some point. I'm not sure about that, but now it's timely. P-card is still the preferred way to do it, to avoid the need of having to go through the reimbursement process. The action updates that are being issued by the university includes the policies as they're changing, but again, working with your department business people is the best way. If you haven't caught a change in the emails and you haven't had the bandwidth to dig through the policies that have changed over time, your departments should be aware of what the policies are. Be sure to check with them and not go with what you think it might be and not ask the question. We are, of course, as the situation evolves, completely operating within the bounds that are established by the state and by our sponsors. So those are two different bullets, but they're really the same thing. We are doing our best to be responsive and nimble within the bounds that are defined for us by others, and those people themselves are being responsive and nimble, hopefully, as the situation evolves. So yeah, that's it for financial for the moment. Next slide. Yes, so access to open office. We've talked about this a couple of times already. probably going to be managed by departments and colleges, but we have heard you loud and clear. This is a major issue. A lot of people want one-time visits. A few people want a short-term, like multi-day, moving out of their office or moving a lot of stuff. We are working on this for you. Home office needs are very closely coupled to that, in part because even if there's things you don't have in your own office, we might be able to find you things that people have sitting idle in their labs or offices. A lot of people wanted scanners, document scanners. I have one in my office that's sitting idle. I don't have a good way to get into my office, but if somebody needed it, and if we're starting to let people come visit offices, we can start maybe looking at what permissions are required to loan things from one unit, from one office to another person who's requested them. And the other category where there were only a few responses, but I understand from other sources, this is a huge challenge, is sort of personal services, which I'm putting into the category of childcare, elder care. With all the schools closed, there's a lot of people who have to do a lot of things themselves because they can't bring in, even if money weren't an issue, they can't bring in services to their home because those services don't exist and they used to be provided through public schools and whatnot. We're working on this. We're very open to ideas. Most of all, I'll tell you, I don't know how. I am in a situation like this myself. I am very sympathetic and I will keep things in complete confidence if you want to talk to me. I have small children. I understand the need. My wife and I both work full time and are balancing that from home. If a lot of people might not be comfortable talking to people to raise concerns and ideas, please consider me to be a safe person, at least because I'm living this myself. I have two twin first graders who have been home from school for 3 months. I'll do what I can, so talk to me. But also the employee assurance program, employee assistance program is something we've always had as part of our benefits as state employees. I'm not sure how much they'll be able to do because it depends tremendously on the individual cases. But one of the things they've always been able to do for us well before COVID is help find individual solutions to work-life needs, like finding childcare or finding elder care. And I expect that it's a harder job for them now, like it's a harder job for everybody. But they are a resource that the university, that the state pays for to help us with these things. And if you haven't reached out to them yet, please know that they're available to you.
Thank you so much for going through these questions and also for reaching out a hand to help. You're reaching out to the library and to procurement and other offices is so meaningful, I think, for the entire community there. So I appreciate that on behalf of all of us. With that, I want to go over into the question and answers. And I understand from Dean Drake that he may have some connectivity issues. I'm not sure, Dean, if you're on by internet or you're on by phone. Are you with us?
While if you're on my phone,
are you there, Don? Dean?
He emailed earlier to say he wasn't, and then he emailed to say he was back. I know he's.
So let me go to the next slide, and Dean, once you're coming back online, we will go back to that. I want to work you through the next steps of relaunching RCA that started with the survey back on May 15. We are currently here at the town hall. So we launched a survey 2 weeks ago. And again, thanks to all of you who took the time to fill out the survey. We spent the last week to really analyzing. We shared a lot of those updates with you. We had a good number of conversations with the RCA task force members and started, as you heard from the associate deans, reaching out through the dean's offices, department chairs in the meantime to many of the faculty directly. And today, as I said, was the town hall. We also obviously will plan to have additional town halls in the future, especially as we're getting very close to eventually reopening. Plan was clearly working against June 1, but knowing from the last few days that we now have until the middle of June, it gives us a little extra time to create the guidelines and eventually a DocuSign form, not along the line that Aaron Lavick was outlining, and that will be filled out by the faculty, approved by the chairs of directors and by the deans, but it will require reviews by facilities managers, management, environmental health and safety, and other parts on campus to make sure that we meet all the various needs there. And then by the end of next week, our current plan is to really have a pretty good handle on the groups that we can invite back as part of the very first group coming back, so that it allows those of you a little bit of time to actually prepare what it would look like on your end. And so that is the current plan that we are. Let me reach out. Is Dean back online by any chance? He had some internet difficulties, and if he cannot join us, unfortunately, he is the one who had all the questions. And he did share with us in the prep meeting that it was just a handful or two handful of questions, and so rather than going through them live here in the town hall, I suggest we do what we have done with the previous town halls. We actually have gone back to just about anybody who had asked questions in advance and gone back directly. And I know Dean and Don and others have already reached out to some of you who asked questions in the last 3 days. So we're going to skip that part right now. And I'm sure nobody is minding that we give you a half an hour extra time in the day. If there are any last comments from my panel members, let me go back to the overall screen here. Any last comments from any of the members that participated? I see a lot of no thank you. Again, my thanks to all of you for joining us here today, both our attendees, but also the panelists, and also my thanks for the time and dedication you've spent over the last, it's 3 months now, as we are working through this. On that note, I'm going to call the meeting to a close. And as we said in the beginning, the meeting has been videotaped. It will be put on our research website in the next few days. And by the end of today, most likely we will have these slides posted. So I just see that Dean Drake is joining us. He's on the phone, but you're on mute. You cannot hear us?
Dean, I've unmuted you.
Yeah,
You're back. I was just going to call the meeting to a close. So do you want to say a few words about the Q&A? Because I'm sure a lot of people say, yay, we got another half an hour to go home to do other stuff.
I'm trying to.
What I said is there were, from what you shared with us earlier, there were just a small number of questions, and it might just make sense to go directly back to those individuals.
There were a few questions, guys. Sorry about the internet, and I apologize. So we had multiple questions about the safety and the PPE and campus access. As Carl had mentioned, the PPE will be provided. Mike Pound and his team are doing a great job trying to access sufficient quantities, but in the meantime, please, also try to think about ways that, if you have it at home, bring it in. If you don't need it, it's going to allow us to distribute what we can get a lot easier. We are not able to physically block campus, but overall guidelines are expected to be posted on the COVID-19 page next week. Face coverings will be required transiting through buildings, and anytime a 6 feet separation cannot be maintained. High touch services such as door handles, sinks, fountains, hand railings, and all the buildings will be cleaned several times a day, accordance with CDC guidelines. And they're looking at signage and trying to develop signage for each building for proper spacing, capacities for elevators, and other things. One other question had come up about the whether the health center would be providing testing, the UMBC Health Center. We don't know yet. UHS is looking into this, and so stay tuned. We had several members of the community wanting to know about the library, and that's come up a couple of times so far during the presentation. The library will follow protocols established by the campus for phased reopening, including installing sneeze shields and having PPE available for staff, and installing patterns for traffic flow, as well as monitoring who's in the building for potential contact tracing. In addition, the library management team is formulating a phased reopening that may mean it will be some time before we can wander freely in the building again. Once there is permission to be in the building, we will slowly restart interlibrary loans, but this service will depend on the academic library's reopening. Most likely, library staff will page materials for folks and place them in a safe place for retrieval. Reference assistance and bibliographic instruction classes have pretty much moved online. So reopening of the library will be careful and thoughtful, keeping the safety of staff and patrons in the forefront. One other question that was raised was dealing with travel. And will UMBC release faculty research funds for travel abroad as soon as the State Department lowers safety warnings and Maryland lifts the lockdown? What levels are you looking for? We would also need to see the Centers of Disease Control Prevention lower their warning levels for the proposed destination from its highest level, which is level 3, avoiding non-essential travel. Additionally, before travel, you should consider things like flight availability, travel restrictions imposed by the countries you're visiting, and or transiting through. Mandatory quarantine periods might be there, and current health infrastructure is another thing to think about. This is not an exclusive list. You know, think about it, it could be the hotel, the buildings you're visiting. There could be all types of other restrictions that are out there. There were 2 questions associated with IRB that I wanted to address. What guidance is available regarding using remote systems such as WebEx for research? And is there a guide for IRB procedures, best practices for those who have not done this before? Yes, we worked with DoIT. DoIT's come up with some things, and we have that on our webpage. So if you go to the on-campus research directive page under the RCA during the COVID, it's that spot on the upper right-hand corner on the research page. That will link you to something called the ORPC Campus Closure Business Continuity During Emergencies. That page provides information on video conferencing options. The other question with the IRB dealt with protocols and exempt projects that are about to expire. Exempt protocol approvals do not expire. For exempt, we need you to tell us when the work is complete. We also need you to let us know 3 months in advance if you're planning to modify procedures related to your project, and you do that by submitting a modification request. The other part of that question dealt with processing IRBs through Quali. Quali is near and dear to my heart if anybody knows me. We are planning to announce to the campus community a go live for the Quali IRB in the next several weeks. It's very exciting. A lot of work is still going on. We're doing the data transition, the data entry now. And so if you want updates to Quali, please visit the Quali page, and there's a place up there for an implementation schedule that will provide you a lot of information about where we are in the different phases of Quali. And as always, please feel free to reach out to our compliance office. Tim Sparklin and Andy Glenn and Mary Lilly are always eager to help in any specific questions associated with not only IRB, but IACUC, Institutional Biosafety Committee, and other things. Short-term access was also a question that was raised, and I believe Carl addressed that, the team addressed that on how we're approaching this. Once the new form is created, we expect the method for requesting access to campus, that the RAET process will be that method for requesting access for RCA activities. Lastly, there's been a lot of questions about the difference between RAET, ALEET, and academic approval on campus. ALEET stands for the Applied Learning Experience Emergency Team, and the RAT, of course, is the Research Access Exception Task Force. And we have the different forms available. There's also an academic approval that's out there. Now, leadership is working on a decision tree to assist all members of the community in following the appropriate process for access to campus or external locations. I do understand that the LEET is submitted by students when it involves and requires an outside organization approval. The RAET is for the research creative achievement activities that would be submitted by the faculty. And academic, of course, is the teaching and education. This is really oversimplified, but I did want to let you know that more information is forthcoming on which process to follow depending on your specific needs. Carl, that's all I have. Thank you, everybody, for your patience. That was really freaky for a while.
Thank you for working through it. It was perfect timing in the end. We have a couple of questions that came in online. I'm going to take one. I'm going to ask Don to respond to the other one. One of you asked about why can faculty not just go to their office to work, right? We're already going to grocery stores, and why can't we come to our office? And that's a fair question. The reason for that is, number one, currently both USM and UMBC are not comfortable to bring anybody back, right? We're very minimum number of people on campus. There's 4 or 5 teams currently working on COVID-19, so that's close to 0. And that's the only researcher. That's one piece. Number 2 is for any of you who are coming back to campus, even to just be in your office and close the door, there are other people that then need to be there as well. Building managers, you will touch, we had this conversation earlier, frequently touched surfaces need to be disinfected, bathrooms, maybe the coffee machine, all the things that one does as one spends all day in an office. And we are at this time not ready to say we can provide you with an environment, because it could be you are coming, but there may be 3 other colleagues in the offices next to you. This is all manageable. This question is something that's clearly in front of us, but we will need at least a couple more weeks before we have all the various parts and pieces in place to enable this. Many people say that is probably really low risk activities if you are by yourself in some space, be it in your lab, your studio, or your office. But some of these decisions also need to be made together with the deans and the chairs. So that's a quick answer. Don, you saw the other message, the other question. Why don't you take that?
There were a few. I'm not sure which one. There's one more.
The access to mail, I believe, is what I saw.
I'll address that one. We have a question from Nancy Kuzmal. What is currently happening with mail that has arrived on campus since March? I now know the answer because Margot Young kindly submitted the answer as a question, which was the only option available for participants. And Margot wrote, for mail, they are holding it unless people stop by to physically pick it up. Don't do that. I don't think there's a way for you to do that, unless maybe arrangements have been made individually, but don't just show up to pick it up. But they're holding it at the apparently at the Campus Card Center, or the people who work with the Campus Card Center are involved in it being held. They have a website, campuscard.umbc.edu, and their phone number is on their website. It's also in the Q&A. So you can contact them if you're expecting mail that is time sensitive. There was another question that was asked, why is the RAC not included on this chart? Presuming that meant the RAC, which is our activity center. We surveyed for a drop down of buildings, and then we let people type in any additional buildings. We wanted to keep a very open mind towards what would be needed. And I believe the chart included any building that was either mentioned or mentioned above some minimal threshold. So the RAC didn't meet that threshold. We did give people the option to list any building they wanted to list. And we had a more recent question.
Don, I think I've got that one.
Sorry?
I've got that. So the square feet within the labs question that came up, the 300 square feet is causing some confusion with the lab sizes and that type of thing. Please reach out if you're biology, chemistry, please reach out to Chuck. He has the floor plans. Kai's floor plans are coming, but those floor plans will provide you with a guidance on how many people per lab. And as Chuck mentioned, there's a lot of factors involved, and you guys know your labs the best. So please, those floor plans will help you identify that. The other thing I wanted to add to Don's response regarding the mailroom, if you go under employees under the COVID-19 page, there's a page called Campus Access and Facilities. Look at that. That will provide you some guidance, especially if you need a one-time visit to your office. Those procedures are there, and they're available for people if you need one-time access to go in and short-time access.
I was sent another question through individual chat, so it was private, so I won't say this one. Thoughts on opening campus research with human subjects? This is mostly done off campus. Now, there are people who can better speak to this, but my sense is we haven't banned human subjects research. We're just abiding by all of the rules of the state. So if you were doing human subjects research by phone in the first place, there's no reason it would have changed. I'm involved in a project that's having people do VR stuff, but they're doing it in their homes as human subjects. For human subject research in person, I believe that we're just abiding by all the rules we have to abide by in terms of in-person contact. This is specifically asking about off-campus human subject research. Dean, do you have anything to add? I don't think Tim is.
Well, I can add something to it. I don't know where this question comes from, but I'm, for instance, using the Erickson School, who works with a lot of retirement homes, and you may want to work with those individuals, but under the current conditions, you may not get access into those facilities, right? So there's that, and we have no control over that. That's something you, as a researcher, would know before we do, that the XYZ facility is opening. That's one question. The other one, in the survey itself, was a section about human subject research, and in some cases it is questionnaires. And I know many of you in areas like psychology would like to be in the same room with the people you're questioning, but it's a new world out there. So it would be really good to think about how you do this online, like Don said a minute ago. But in other cases, you might actually need to work in physical contact with somebody. And the question, look, anything is theoretically possible, but you need to make sure you have the proper personal equipment, that if you really are in close contact with a number of individuals for hours on end, that is no longer just gloves and a regular mask, right? And so we're not saying no just as a blank, but it requires a good number of additional precautions that are relevant to COVID-19. Dean.
And I would also like to add, again, Tim Sparkland and his team, Mary and Andy, are happy to answer questions associated with your IRB protocols. If you need to change the scope of that protocol to include additional safety measures, please reach out to them for the guidance on how to do that. There are there's a lot of information out there from various sites that provide guidance on the new reality that we have in protecting our human subject population. And so please reach out to them. There are things that they can recommend, and often those things are allowable charge on the agreement or on your sponsored award, as long as it meets the requirements associated with allocability and all those things. So please feel free to reach out to them with any questions associated with your protocols.
With that, I'm going to bring it to a close. Really, again, thanks to everybody on the panel for participating and all the work you did to get us to today. And thanks to all of you who have participated out there. There will be more announcements coming soon, and another town hall probably 2 weeks from today, as we're getting closer and closer to the eventual reopening. So I hope you enjoyed the weekend, and we look forward to seeing you again. Take care.